We're starting to see things of patient empowerment, better ways for physicians to use their time, AI to go through all of a patient's data and crystallize it. The net benefit here, multidimensional, is profound.
Hello, everyone. Welcome to Interconnected, a new series from Equinix that pulls back the curtain on the digital infrastructure powering today's biggest tech trends. Now, today we're launching a special series called AI Renaissance, where we'll be exploring how AI is reshaping everything from drug discovery to quantum computing. Imagine a world where most illnesses never become a crisis because, AI is catching these problems early.
Yeah, Shanil, I'm super excited because we've got two amazing guests with us today. One's a tech leader who helped modernize the state's Center for Disease Control and Prevention as the chief software architect, and he's now building a company at the cutting edge of healthcare at the intersection of blockchain and AI.
Yeah, I'm super excited as well. But, before we get into that, we're going to be hearing from a true pioneer in medicine, AI, and longevity science. You may know him, Dr. Eric Topol. He's a geneticist, scientist, cardiologist, and executive vice president of Scripps Research, the largest nonprofit biomedical research institute in the US. With over 370,000 citations, Dr. Topol ranks among the top 10 most cited researchers in medicine. His latest book, Super Agers, explores how AI can revolutionize everything from cancer screenings to chronic disease prevention. Dr. Topol, it is such an honor to have you here today. I am so excited to dive right in.
Oh, much appreciated, Shanil.
Dr. Topol, let's begin by looking at the big picture. If everything goes to plan, in a best case scenario, integrating AI into modern healthcare systems, what does that world look like in 5 to 10 years? Or what might be that dream scenario within our line of sight?
Well, I think the big potential here, there are many dimensions to it, but the one that excites me the most is the ability to prevent the major age-related diseases, cardiovascular, cancer, and neurodegenerative. We never had that capacity. We've talked about it for a long, long time. But now, by integrating many layers of data, that potential is right before us.
So how might that happen? How would AI facilitate the improvement or the elimination of those types of issues?
So we know these three diseases take at least 20 years from the time they get started to the time they actually clinically manifest. And they all involve a defective immune system, so-called immunosenescence, and untoward inflammation with aging, known as inflammaging. It turns out if we have all the layers of data for a person, electronic health record and their labs and their images, and you add these other features like the retina picture analyzed by AI, like polygenic risk score, proteins, and biomarkers, you can pick up the ones who are at increased risk for these three major diseases long before they ever would have the first symptoms. And that gives us the opportunity to go into high gear prevention so that we can really prevent these diseases. It's really exciting opportunity.
Yeah, this is going to be groundbreaking for preventative care for sure. I think you have some estimate of how close we are to it.
Well, I think we can do this now. We're missing one part of the story, which is being able to get a quantitative assessment of our immune system. That's the one piece missing, but we still can work with what we have. So, for example, with Alzheimer's disease, if you have a family history, have a high polygenic risk score, you can get a p-tau217 test now, and that will determine whether you really are at increased risk. And if you go into an exercise, weight loss, healthy diet, good sleep quality, you can reduce your risk markedly with that biomarker. So we have ways even now to prevent each of these diseases, but we're going to amp it up pretty darn soon.
What does it look like to map that immune system, and maybe in layman's terms?
Yeah, well, it's the most complex system in our body, and relative to the brain, which is the most complex organ in the body. But in order to get a handle on this, you want to know every pathogen a person's exposed to, all the viruses throughout their lifetime. You want to know, do they have antibodies directed to themselves? What type of antibodies do they have? How functional are their B cells and their T cells, which you can find also by doing sequencing of their receptors. And so there's a lot we can get. In fact, there are different startup companies that are working on different pieces. No one has yet done the whole comprehensive sweep, but that's in the works, I think. And once we can do that, that'll be part of an annual assessment, particularly in people at increased risk. It doesn't have to be very expensive. And it turns out right now, Kyle, there's an immune system clock based on proteins that is becoming available. And this will tell you if your immune system pace of aging is faster than your chronological age. So when you see that it is by a few years, several years, you know you have a problem with the immune system. Whereas if it's younger than you, your immune system, that's a really good, healthy sign. What's amazing is here it is 2025, and we haven't had a good way previously to assess it.
Wow. I'm very interested. Sign me up for one of those tests when they become available.
Zooming back to what we had spoken about before, you said that you think we are already there or we're just a few months away from being at that point. What's next?
Yeah, that's a great question because so much of this is available today. Or, as I mentioned, the protein organ clocks will be available later this year. The problem is the medical community hasn't shifted at all. So this is probably going to be a grassroots savvy patient driven thing. It's really unfortunate, the lag from great body of evidence and new knowledge to the implementation in routine medical practice.
So, Dr. Topol, there's this concept of multimodal AI. Could you tell us more about the implications of that?
Yeah, so there's all these different layers of data, and they're not all of the same type. They're different modes of data. So it could be the scans that you've had. It could be your genome or your polygenic risk score, or it could be these protein biomarkers. It could be your lab tests, which the doctor and you always looked at through your portal. Everything looked normal, no asterisk, but it turns out the AI picks up that the trends are in the wrong direction, missed by patient and doctor. All these layers of data that have to come together to then at that point in time, with the entire body of medical knowledge, which is changing every day, to say, Kyle, you're at risk for this condition, and here's what you can do to prevent it. Or at the very least, put it off by a decade or longer. So it's a lot of data for any given person.
Yeah, that's so revolutionary. I just had my annual physical a couple of months ago. And of course, I get all of my data, like from my blood tests and everything in my patient portal. And it's all Greek to me, right? I have to go look it all up on the internet. I'm messaging my physician. Is this number okay? And he says, I'm not concerned about it. And here are the reasons why. And I really look forward to that day that a system that is interpreting all of this is translating and giving me recommendations. That's where we're headed?
Yes, no question. It's just a matter of when, and it always takes longer than it should. We've identified the two big pieces. One, a better way to tap into the immune system of a person, but then also, that AI validation of the models. The big tech is working on this, but there isn't one out there that's, readily available.
Well, shifting gears just a little bit to what we were talking about before, do you think we're on that right trajectory to realize like your future best case scenario?
Yeah, so there's many other dimensions of the AI potential benefits. So already we're seeing just from the conversation in a clinic visit, the content can be used to take care of all the keyboard work, like the pre-authorization, the future appointments, prescriptions, lab tests, procedures, the works, right? And also nudge the patients about things that were discussed during the visit, like checking the blood pressure or how much physical activity and that sort of thing. So we're seeing a liberation of keyboards to some extent with a few hours a day of less data clerk work that clinicians don't want to do, which potentially gives more time with patients, being present, engendering trust, demonstrating true care of patients. Also, more patient engagement with their data, being able to diagnose common things like an arrhythmia through a smartwatch, a urinary tract infection through an AI kit that can be had from a pharmacy, ear infections through a smartphone app of children, being able to prevent having to go to the doctor to get the diagnosis. So we're starting to see things of patient empowerment, better, efficient ways for physicians to use their time, AI to go through all of a patient's data and crystallize it so it saves hours of clicking through pages. The net benefit here, multidimensional, is profound, and eventually we'll get on that benefit track, I'm sure, and it's already taking hold now.
Yeah, speaking of that benefit track, what do you believe we'll get treatments for first? Like, what do you think we're on the right track to get addressed first?
Well, I'm definitely with you that we need better treatments for many of these conditions, but even better is preventing them. Then you don't have
Got
to
it.
get these treatments. However, as you know, there are now over 50 companies that are into AI driven drug discovery. In fact, even during the pandemic of COVID, we saw a AI discovered drug repurposed, a drug that was used for rheumatoid arthritis now is shown to improve survival in people with severe COVID requiring hospitalization. So AI is helping treatments. The problem is most treatments are not cures. We can't rely on the treatment side to make huge differences as much as we can on the prevention side.
Right. But the true winner there is probably like getting ahead of it. So that preventative care is going to be really key to our future.
Yeah, and to emphasize, Chanel, we didn't have any way to do that before. We had very limited tools. And so this is what I consider the next frontier for AI in healthcare, because now things have really come together. This makes a big difference.
Dr. Topol, it's likely that our listener base has a substantial number of technologists, engineers, application developers, those involved in the AI ecosystem, maybe even starting technology companies. What would be like your big ask from that community, how they could help move this along in pursuit of everything that you've just said today?
Well, I'd love to see them help us get these multimodal models for prevention for age-related diseases going. We've never been in a better position to do that. This is such an extraordinary time in medicine, but it does rely on the human expertise. This is going to be a bit of a challenge because, as we've learned, when you have time series data added to all these other layers of data, it's not such an easy integration challenge. And so that's where we need some of the real experts out there.
Challenge accepted.
Yeah, right.
Yeah, I mean, remember that if you start at age 50, you get 7 to 10 years of healthy aging. If you start even earlier than 50, you get even more years. So that's why hopefully it'll be an inspiration. We're going to make a huge difference and we can put a big dent into the major diseases that compromise our health span.
After that fascinating look at where healthcare is heading and how AI is already changing the landscape in healthcare, we're going to be shifting gears a bit now and talk about what it actually takes to make that vision real, behind the scenes in the infrastructure.
And we're joined by Jim Nasser, who's worked inside one of the largest public health systems in the world and now leads an award-winning company building decentralized, future-ready healthcare tech. He's the former chief software architect at the CDC, has co-authored several books, created a course on token economics for the University of Georgia, and guest lectured at institutions like Harvard and Georgetown. As CEO of ACOR, he and his team are tackling some of the toughest problems in medicine today. Jim, it's so great to have you.
Yeah, thank you, Kyle and Chanel. It's a pleasure to speak with you both, and I appreciate that introduction.
And so let's just get started. And I want to start by talking about infrastructure impact. Now, I want to hear your thoughts on what do you think are the biggest infrastructure concerns or, maybe the opportunities when it comes to the integration of AI innovations into healthcare?
If we had this conversation, Chanel, maybe a year and a half ago, I think cost of cloud, cost of storage would have been number one in terms of infrastructure. I think now cost is certainly an overriding, issue. I think AI in particular consumes a lot of resources. But then there's also, the ongoing issue of storage and processing or compute power. And how do you do it? How do you make it sustainable? I think if you look at it from another angle, and this is one that we're acutely kind of aware of just because there's always a budget concern, is how do you do infrastructure in a way where you don't centralize all of the compute power or all of the data training, as an example, and also make it more sustainable.
So Jim, cloud and storage are probably essential and givens in the landscape of technology that we're in. So what kind of ideas or solutions would you propose to lowering those economics or cost of cloud and storage?
Yeah, there's a lot to be said for really understanding your data and how do you minimize this idea of data minimization and really what needs to be exposed to various services. Is that efficient? I think that there are a lot of techniques you have to consider with all of that. And in the health space, really the majority of data, I've heard as much as 97% is private data is within the enterprise. And oftentimes it's actually not on the cloud natively. So the question, I think that's really where I would start, the first principle is, do you need to move the data to the cloud to begin with? Once you've kind of done that, then particularly with AI in mind, then the next question is, how do you do private compute? How do you do private AI training, model training, model lineage, things like this? And it turns out there are a number of things you can do that maybe you're using some cloud resources, but it's really much more of an edge compute type of model. And I think finally, certainly from where we come from, we think that a decentralized approach where you're using possibly much lower, cost resources, maybe they're decentralized, distributed, there's multiple nodes, if you like, that's an alternative, right? Again, it's not to say that's the only reason why you'd want to consider decentralized technologies. I think there's a lot of other things, but certainly sustainability is one reason.
Jim, we just talked to Dr. Eric Topol, and he really talked about the multimodal needs for data in medicine and healthcare. And it really opened our eyes to just how segregated this is going to be. I mean, I walk away from that assuming that it's a given that our patient data will be highly decentralized. And you've been at the core of decentralized and open systems in your career. So maybe could you walk us through a little bit more of an understanding of how the architecture of that works in medicine, and maybe how patients can ultimately be in control of that data?
Yeah, certainly. And again, I think from a vision perspective, I don't disagree with Dr. Topol. And I think if you take certain parts of the world under certain regulations, for instance, in the US, we're still some long ways from really patient-owned data. And ultimately, all of us here in the US, even if you're within like the largest networks, it's very, very likely you have multiple records within different systems. Okay. And none of that really helps in terms of usability for the patient or the value for the patient.
Yeah, I mean, I've lived that and experienced it. I have multiple hospital systems and doctors and care, and I'm multiple patient portals. And I find that, somewhat frustrating to traverse and navigate. But is there anything we as patients can do to try to help influence that?
That is the good news, which is yes. Okay. So in America and in many other countries around the world, you can use your agency to essentially ask for your data. You can share your data with whoever you want to, including third parties. So you mentioned, Kyle, that you have multiple systems. I bet you go to like a MyChart, you're able to look at your records. You do a download as a PDF. You could even possibly download as an XML or maybe even have an API. Those are ways in which you're allowed to do it. I think there's an inertia challenge that we do have to work on, which is helping patients understand, why should you do this? Why does it matter? What's the value of going through this discomfort of getting your data, downloading it, maybe uploading it somewhere else, really much more proactive, in saying, look, as a patient, not only do you have your agency and choice, but now we're forcing that all of the systems and the networks actually provide this to you by default, as opposed to you having to go way out of your way to kind of change this situation from a centralized vendor-owned model to one that is much more about data ownership at the patient level.
So we need some more advocacy in that area, because you said some countries are definitely doing this, but we don't really have a lot of that here today. What do you think needs to happen for an infrastructure edge to actually make that work at scale?
Yeah, it's a good question, Shanil. I would say the biggest problem isn't a technology or infrastructure. I think a lot of that actually is in decent place. I think even usability at the app level or wearables is really pretty decent, and it's in line with consumer level expectations. I think what is in there, as example, is for your physician who's already overburdened to be then incentivized to talk to you as a patient, and the relationship between patients and health networks is almost entirely to a trusted provider relationship, but those providers then inadvertently are becoming gatekeepers to letting or kind of providing advocacy for these patients. I think in terms of infrastructure, I'm actually pretty confident that the infrastructure is there. I think that there's some work to be done on things such as edge computing and making that more available and things like this, or verifiable. But honestly, I feel like those are really already in good enough shape to certainly start kind of scaling.
Jim, what would be the best case with AI in that decentralized world?
Yeah, it's a really good question. I'm a little bit biased, but I will say the best case for AI, almost in any context, but decentralized, is that you're able to do private AI and do it as fast, if not faster than cloud-based AI, maybe do it much more on a much more contextual basis. Like I'll give you a specific example. We're working right now with one of our clients in the public sector on discovery from autopsies. We don't need to have hundreds of billions of variables to train our model. Maybe we need 100,000. Using private data, do it in a way that's secure and cost efficient and decentralized. So they don't come back to us and say, well, Jim, now we have to trust you guys and you're a small company. The idea is for patients to own the data. So if the patients are owning the data, supposedly we are individually giving consent for that data to be used in specific contexts. So that's very much a decentralized model. I think it's about, can you do AI privately and sustainably, but in a much smaller context than these giant foundational models.
Yeah, I know you said you can get better results with more data, right? So I feel like there is this conflict that we're experiencing where you want data abundance, but we're also moving to this era of like sovereignty, right? So it's like there's a bit of conflict between the data abundance and the sovereignty. How do you think that we should be able to, or what's one thing that you could say to customers in general to help them to want to donate data for the greater good?
Yeah. So, I mean, again, this is where I think, depending on context, Shanil, there is some beachhead. We do quite a bit of work, as example, like you mentioned, Kyle, with cancer, but tracking things like inflammation, which is at the core of cancer, is one of the causalities of cancer. That's really important, getting that data. So maybe the incentivization is just through like a easier to use app or strategic placement of these scientific initiatives within things that people already are doing. A few years ago, we were working within the neuroblastoma clinical research space. It's a deadly form of pediatric cancer. It turns out not just for neuroblastoma, but almost any number of rare diseases or deadly diseases, the much greater need is to find treatment, find that clinical trial. That's hard to find too, it's hard to get into. Find patient communities to exchange information with. Obviously, starting there is actually best case scenario because they're already motivated. They really don't even need to be extra incentivized. Other than perhaps this idea that our data is going to be used for the greater good, just like you were saying. It will help, with improving clinical research, with improving access to trials, things like this.
So we're there, we're close, and I'm hoping that our listeners and not just professionals in the healthcare, but also patients can listen to this and also be more trusting about sharing data for the greater good.
A huge thank you to our guests today for helping us reimagine what healthcare could be with AI as the accelerant.
And you know what, Kyle? This is just the first in our AI Renaissance series. I definitely recommend you sticking with us because the future is coming fast and it's going to be intelligent.
Thanks for watching. Dive deeper into this conversation with an extended cut found wherever you get your podcasts. Don't forget to like, subscribe, and comment, and check out these other videos to learn more about the world of digital infrastructure.